So during our programme, when we were visiting maternity services, we found that leadership varied a lot, and there was often a disconnect between the executive board and the maternity services and the midwives. Some leaders that just weren't visible at all, and staff didn't know who their leadership team were.
You have high turnover of some of the executive leadership teams within some services, and which then ensured there was a lack of oversight around the maternity services, and there were also lack of priorities as well within the maternity services.
So the impact of poor leadership and culture on women is very much focused on that teamwork, that multidisciplinary team working together, all with the woman at the centre of the care, working around them. If you have got leaders and disciplines at loggerheads, then women don't get that seamless care.
Good leadership for maternity services is all about the executive board having oversight of the service, taking control and knowing what's going on in their service and knowing their staff. So we would go to some services and we'd be shown round by the director of midwifery, and they knew everybody. They could talk to people by name, and that was the same for the lead obstetrician. If they were a really good leader, they knew their staff, and that led to an open culture where staff were able to report concerns and that they felt listened to, and that those concerns would be actioned and taken seriously.
For staff growth and retention, a good leadership and culture will mean that staff feel valued and very much listened to and much part of the team, and be able to understand what their priorities are, how they're all working together and what their role actually is.
Some of the examples we've seen around a learning culture, some of the governance teams, they have scheduled time to go around the services. They have like tea time. It gives staff the opportunity to ask questions, but also feedback around some safety incidents and what the trust of the services are doing around that. One of the services where there were issues around culture, but the well-being of staff, they've had protected tea times for staff to have sort of like a tea break, but a meeting where staff are just telling leaders or even their colleagues how they are feeling. And it's not just around what's happening or around safety incidents, but it's around the well-being of staff, and staff feel that was really, really helpful, and it helps them to have that sort of like closeness. They get to know each other, and it helps to break down hierarchy and improve the MDT working within staff, and in turn it helps to improve the outcomes for women.
So an example of good leadership and culture that we observed as part of the programme was board safety champions holding forums both virtually and face-to-face for staff to go to raise concerns, share ideas and tell them what it's like to work in that service. We saw activity logs so that any feedback was discussed and they were able to feed back to the staff member what had been done as a result of that, so they could see that flow of information through governance.
In a good culture and a good leadership, director of midwifery are able to report into board. They're able to tell them about all the things that are affecting their service, and the board can then look and see whether they need to put more resources, whether they need to look at their financial situation and what improvements need to be made in the maternity service.
So having a strong, compassionate and inclusive leadership will help in terms of understanding what the issues the maternity services face and how to use that to drive improvement. And having an inclusive services will help to address some of the issues around health inequalities within the maternity services. And a strong leadership team would know what those pressures are and how to ensure there is a safe maternity services that's inclusive within their population, and the voice of women are heard, including anyone that might be from an ethnic minority background.
We're at a very difficult time when midwives are leaving the profession very, very regularly, and for leadership to value their staff, to know that they're being listened to and be heard, then that absolutely will help with the retention of midwifery staff in the future. The difference that a good positive leadership and culture and the retention of midwives will lead to a much safer delivery experience and pregnancy experience for women and their families and their babies.